Have you ever heard of type 2 diabetes? Is it diet related? I'm no doctor or a health consultant or a health nutritionist and therefore fail to provide a correct answer. However, we have in our companionship a dynamic professor, Dr. Lalita Kaul, who will talk to us about diet and type 2 diabetes. Dr. Kaul is a well-renowned professor at Harvard University College of Medicine.
Good morning. Welcome to Health and Nutrition segment. Today we are going to talk about common sense guide to eating for people with type 2 diabetes. In this segments of health and nutrition, I have talked several times about diabetes, and it is purposely because I am trying to find the information more and more in a simpler way, which is easier for people with type 2 diabetes. The type 2 diabetes is really increasing very high, both in Indian Americans, other South Asians, American. It is gone too much. And I again want to wish to tell you that these are recommendations. Nobody is forcing that you have to follow, but these are recommendations which will help you to have better quality of life. Of course, in consultation with your physician, he or she may give you medication, insulin, but hand in hand with diet and will help you have a better quality, even may someday get you off the medications or insulin. So, what are the most important eating strategies for people with type 2 diabetes? And these are reducing insulin resistance. I have talked sometimes before the insulin resistance. Insulin resistance is when you have enough insulin in the body, but it is not hooking on to glucose. It is like having so many keys, but none of them fits, and this can cause insulin resistance. So, that is why it is important to lose weight. I am not saying you have to be skinny, go from size 8 to 2, but just even if you lose 10% weight, just modification. And losing the weight will also cause you to lower your blood pressure. Often you will see people with type 2 diabetes have also high blood pressure, and also the sugar level will be controlled if you lose weight. And your blood lipids like cholesterol, LDL, HDL, you know them as bad cholesterol, good cholesterol, also your medications will be lower. The two most important eating strategies are eat a heart healthy diet. Most of the time the diabetics also get heart problem, about most of them die with heart disease. The 2/3 of the people who have diabetes have also heart disease, and risk of dying from heart attack is 2 to 3 times greater with diabetes. The importance of weight control, as you can see from this slide, is as you can see the body mass index, which is the amount of body fat you have, the more it increases, like when you see it is going over 35, your glucose also rises. So, definitely there is a correlation between weight and the glucose level, and this is the importance of weight control. And again it shows the resistance, insulin resistant is higher if your weight is higher. So, again emphasizing weight loss. Then we have weight loss and healthy heart go hand in hand, and you eat more fiber in the diet, eat less fat, especially hydrogenated fat. This will be your ghee or butter, and that makes you lose weight faster. Do not use refined food, more whole grains, fiber. Now, carbohydrates, let us talk about all these different nutrients we eat. Carbohydrates give 4 calories per 1 gram, and the body, it gives energy to the body, and sugars and starches are both carbohydrates, and some carbohydrates are better than others, like your fibers, your fruits and vegetables are better than simple sugars. Now, we talk about where are carbohydrates found. As I told you, starchy vegetables, which is your corn, potatoes, sweet potatoes, these are starchy vegetables. The grains, you get fiber is cereals, breads, and the fruits. Even milk has some carbohydrate in the form of lactose and of course, sugars. Now, what are the preferred carbohydrates which are recommended are whole grains, vegetables, and under whole grain we have whole wheat bread. You can pasta is recommended to have whole wheat pasta, oatmeal, barley, cereal, brown rice, especially for diabetics, brown rice is much better than white rice. Vegetables, raw, steamed, stir fry, agents like our sauteed vegetables, just saute as long as you don't. Whole fruits you can have fresh or frozen. If you are taking canned, make sure that it is not sugar, always read the label. What are the refined carbohydrates which are not recommended? These are candies, brownies, cookies, bagels, croissants, biscuits, Danish, pretzels, white bread, fat free chips. It says fat free and many of us say, well, these are fat free chips, I have a diet coke. But it again I am saying it is recommended, it is not we are not saying don't do it, you are the master of your own whatever you wish to do. But for I am saying in terms of diabetes, even if it is a habit, you have a dry mouth, we get a candy or we just want a little snack, dessert. But these days the recommendations are you can take some sweets if you take with the food, if your blood sugar is within normal limits. Now, these are what are the some of the choices. Next slide I am going to say what are the choices you can make. For example, instead of white rice, brown rice. You may not like it in the beginning, you can combine the two. Instead of white pasta, whole pasta. Instead of sugared cereal, oatmeal if you like. Instead of french fries, baked potatoes. You can even bake french fries. Candy, whole fruit, and fruit juice, whole fruit. Advantages of whole plant food are, for example, this gives you an example of a bagel breakfast. Bagel gives you high sugar response. As you can see, the carbohydrate in the first is 74 and calories 466. In the second diet, it is 75 grams, even though it is not much higher, but it is a good carbohydrate and calories are less. And looking at the next whole plant is the lunch, say lunch or dinner. The first one, macaroni and cheese, you have 75 grams carbohydrate and 577 calories. And you see the second choice, which has brown rice, broccoli stir fry. Again, if you like these foods, if you don't like it, don't try. So, you talk to your health guidance, that is why I take a detailed history, I make sure. And the next we talk about is should I avoid sugar? You should try to refine, as I said earlier, it will displace nutrient rich food. So, you got to really, it will also call dyslipidemia, which means your lipid abnormality, and trying to use, if you have to have some sugar, non-nutritive sweeteners. Now, there are so many sugar substitutes available on the market, and these sugar substitutes are some were banned because they found the studies FDA they were carcinogenic, but now they have put some on the market. These are which are we have Splenda, we have aspartame, sweet and low, but there are some like equal people who have problem phenylketonuria, that means their amino acid is high. So, they should, some people are allergic to Splenda, so you have to try without that. And now very quickly talking about this gives you proteins basics, and this is different kind of Splenda, and the protein basics are they provide 4 calories per gram, same as sugar. Main function is to build and maintain body tissues if you are in the growth period, and these are the heart healthy sources of protein, which are the next slide. What are the heart healthy protein sources are your lean meat if you eat meat, fish, shellfish, non-dairy products, nuts, seeds, egg whites, and some soy products. Now, the other thing which is very important you should know is to read labels, because labels are very important. Do not put everything you see in the basket, either you get it says it is low fat, low calorie. Some of these facts are misleading. If you go outside and you should look total calories, how many calories are from fat, and that is very important. Now, the facts are 1 gram is 9 calories, and so you should be, that means it gives 2.5 times calories. So, you have to be careful if you are taking fat, what kind of fat is important to saturated fat or unsaturated. Instead of bacon fat, you can try turkey fat, and there is vegetarian this thing. So, it is important to cut down. These are the food labels. As I earlier mentioned, I want to show them in the slides, is you just look at beyond what the label says, they are misleading. So, if some of you need glasses as I do, I just keep it here and read the small print. You have to find if you are allergic to some foods, if you are, if says low cholesterol, is it also low fat? Low cholesterol may not mean low fat. So, look at calories, look at sodium, and because if there is hypertension, food, so it is very important to keep food level. Now, next is dining out. We all enjoy, you have to enjoy what you eat. So, dining out is you must of course, you do not want to be the main center of discussion with your friends and family about your diet. You can make some choices here. Do not have a bread basket after taking one piece, tell them take, depending what the guests say there. And if you are taking salad dressing, ask it on the side. Do not take fried food out. If it is a big dish, share with your friend. If they do not want to share, bring it home. So, these are all modifications. So, the idea is you enjoy, and also, and there have been some minerals which have been, these are further giving some ideas about dining out. There have been some minerals which have been found good for diabetes, is chromium. They have done some studies, and so the chromium supplement is helpful. Vanadium, not yet sure, but magnesium has been shown. Vitamins, vitamin E and C patients. So, if you take from food, the other things which have been shown to be helpful are arginine, which is an amino acid. It has supposed to lower the resistance to insulin. So, you do not want to take high doses, it might create diarrhea. And the herbs, some of the herbs, ginseng, you have to be careful if you are taking something like blood thinners, it might interfere. So, some of this new research, I wanted to bring spices, or instead of salt, use spices. And what if I overeat? Do not worry, you have celebrations, you celebrate and come home next day, get back, or day before start being back on this, but enjoy, and you do not have to. And in meal planning, you just plan with fruits, vegetables. So, in summary, I can say that your diet, after seeing your physician, whether he or she wants you put on this thing, and then you look if you are overweight. Again, I said you do not have to be skinny skin, just in a moderation, and you plan your diet keeping your family in mind if you have to cook for the whole family, and then you, if you are vegetarian, non-vegetarian, plan according to, but your diet should look more grains, fruits, vegetables. I hope today's segment I have been able to make you aware of how important it is for you diet in managing your type 2 diabetes along with the medication if your physician feels you need to take it. Thank you very much for watching this segment.